Welcome to our deep dive. Today it's all about hyperoxia.
Hyperoxia.
Yeah, have you heard of this before?
Um, I have, but maybe
Oh,
not everyone has.
yeah. So basically it just means like too much oxygen
Right.
in your body
Yeah.
tissues. And like we all know that too little oxygen is like a really bad thing, obviously.
Yeah, hypoxia. No one wants that.
Right, exactly. But it turns out that too much can also be a problem. And we're diving deep into some recent medical guidelines and a whole bunch of research studies on this. And you guys, some of the findings are pretty wild.
Yeah, it's really fascinating how something so essential to life can actually have like a downside.
I know. It's kind of mind-blowing.
Yeah.
For a long time, medical professionals, they thought more oxygen was always better. Like, just crank it up, you
Yeah.
know? But it turns out that that's not always the case, and we need to kind of rethink how we approach oxygen therapy.
Yeah, the thinking has definitely shifted. Like current guidelines actually recommend holding back on that supplemental oxygen unless someone's oxygen saturation drops below 94%.
Below 94%. Huh. That kind of seems counterintuitive. All right?
Yes, it does.
Like, if someone's struggling to breathe, wouldn't you just want to give them as much oxygen as possible?
You would think so, right? Like that's our natural instincts.
Right.
But more and more research is showing that that might not actually be the best approach. And there were some early warning signs about this, going back to like 1999, there were these studies looking at stroke patients.
Okay.
And they found that giving these patients oxygen didn't really help them. It didn't improve their outcomes. And in some cases, it even made things worse.
Really?
Yeah. So that was kind of a red flag.
So, like, giving them oxygen was actually making their strokes worse.
Potentially. Yeah. It wasn't helping and it might have been harming in some cases.
Wow. Okay, so that was back in 99. Are there other studies that kind of support this idea that too much oxygen isn't a good thing?
Yeah, definitely. There's this really interesting study that was done in Australia. They looked at patients who had a heart attack,
Okay.
an acute myocardial infarction. And what they found was that giving these patients oxygen actually decreased their chances of survival.
Wait, so giving oxygen during a heart attack made things worse?
That's what the study found.
Yeah.
And not only did it decrease survival rates, it also increased morbidity.
Morbidity. So that means like the likelihood of getting sick or having complications.
Exactly.
Wow. Okay, so we're talking about heart attacks now too. This is
Yeah.
serious stuff.
It is. And there's even more evidence. There were these studies in 2004 and 2007 that looked at newborn babies.
Okay, babies now.
Yeah, tiny babies who were having breathing problems. And guess what they found?
Yeah.
The newborns who were resuscitated with pure oxygen had higher mortality rates compared to the ones who just got room air.
So even with babies, too much oxygen can be a bad thing.
It can be, yeah. It's really important information for parents and for medical professionals to know.
Absolutely, especially for those tiny little lungs, you know?
Right. And these findings were actually so powerful that they led to new recommendations for using room air positive pressure ventilation for newborns who are in distress.
Wow, so they changed the actual guidelines.
They did, based on this research.
That's amazing. That's a real-world example of how these studies can actually impact how we care for patients.
Exactly.
You know, I've been reading through all these studies, and the one that really hit home for me was this study from 2002 that was done in Texas.
Okay.
They looked at over 5,500 trauma patients.
Wow.
And get this, pre-hospital oxygen administration almost doubled the mortality rate.
Doubled.
Doubled, yeah.
That's a huge number.
I know, it's crazy, right?
Yeah.
It really makes you stop and think about the potential downsides of something that we often consider to be life-saving.
Right. Like we just assume oxygen is always going to help,
Yeah.
but that's clearly not the case.
So we've seen a lot of evidence that too much oxygen can be harmful. But before we dive into like the why of that, like the mechanisms behind it, I want to talk about one study that actually bucked this trend.
Okay.
The study was done in Tasmania in 2010, and it focused on patients who were experiencing dyspnea, which is just a fancy word for difficulty breathing. They compared two groups of patients. One group got oxygen that was carefully controlled to keep their oxygen saturation levels between 88 and 92%.
Okay.
The other group got high concentration oxygen masks, just like cranking it up.
Right. Just like we were talking about earlier.
And the results were incredible for patients with COPD, which is a type of lung disease. There was a 78% reduction in deaths when the oxygen levels were carefully controlled.
78%. That's amazing.
I know, it's huge. And even across all the patients in the study, the reduction in deaths was still a remarkable 58%.
Wow. So getting that oxygen level just right can make a big difference.
It can, and it really highlights the importance of precision in medicine. It's not just about giving more, it's about giving the right amount.
Absolutely. So all this begs the question, why is giving too much oxygen harmful in the first place?
Right. What's the science behind all of this?
Well, it turns out there are three main ways that hyperoxia can actually wreak havoc on the body.
Oh, boy. 3 ways, lay it on me.
All right, so the first one is called absorption atelectasis.
Absorption atelectasis,
Yeah.
that's a mouthful.
It is. It's a bit of a tongue twister, but we'll break it down.
Okay.
So basically, when you breathe in high concentrations of oxygen, it starts to displace the nitrogen in your lungs.
Okay.
And you might think of nitrogen as just this inert gas that's just kind of hanging out in there.
Right.
But it actually plays a really important role in keeping your lungs functioning properly.
So nitrogen is important for our lungs. Who knew?
It is. It's kind of like the scaffolding that helps keep your lungs inflated.
Okay, scaffolding. I like that analogy.
So when there's too much oxygen pushing that nitrogen out, the scaffolding weakens and those tiny little air sacs in your lungs called alveoli can collapse.
And that's what atelectasis is.
Exactly, the collapse of those air sacs.
And when those air sacs collapse, what happens?
Well, it becomes much harder for your lungs to do their job, which is to exchange oxygen.
So you're getting all this oxygen, but your lungs can't actually use it effectively.
Oh, yeah. It's kind of ironic giving too much oxygen can actually lead to less oxygen reaching your tissues.
Wow, our bodies are so complex.
They are. There's a delicate balance at play, and we can really mess things up if we're not careful.
Right, so that's absorption. Atelectasis, too much oxygen pushes out nitrogen, and the air sacs in our lungs collapse. What's the second way that hyperoxia can cause problems?
The second way involves those little troublemakers we call free radicals.
Free radicals now we're talking.
Yeah, so free radicals are these unstable molecules that can damage cells and tissues. They're like tiny little wrecking balls bouncing around in your body.
Wrecking balls, I like that.
And most people don't realize this, but oxygen itself is actually a free radical.
Oxygen, a free radical. What?
Yeah, crazy, right?
So we need oxygen to live, but it's also a free radical.
It is. It's all about balance.
Okay, so how do our bodies deal with these free radicals if they're so dangerous?
Well, our bodies have a pretty good defense system in place. We have antioxidants that help neutralize those free radicals and keep them in check.
Antioxidants like the stuff we get from fruits and vegetables.
Exactly. Those are some of the good guys.
So what happens when this balance gets thrown off?
Well, when we experience things like an injury or trauma, or even just the normal wear and tear of life, this balance can get disrupted, and we can end up with what's called oxidative stress.
Oxidative stress. So that means there are too many free radicals running around causing damage.
Exactly. It's like having a bunch of tiny wrecking balls loose in your body.
Okay, so how does hyperoxia fit into all of this?
Well, when we flood the body with extra oxygen, it's like we're pouring gasoline on a fire. Those high oxygen levels can increase the number of free radicals right at the site of injury, making the damage even worse.
So too much oxygen can actually make injuries worse.
It can, especially if there's already inflammation or damage present.
That's crazy. I never thought of oxygen as a potential source of damage.
Yeah, it's definitely counterintuitive.
Okay, so we've got absorption atelectasis where the air sacs collapse, and we've got free radicals running amok. What's the third way that hyperoxia can cause problems?
The third way involves something called vasoconstriction.
Vaso what now?
Vasoconstriction.
Okay, break that down for me.
So vasoconstriction is just a fancy word for the narrowing of blood vessels.
Okay, narrowing of blood vessels.
And it happens because high oxygen levels can displace carbon dioxide in the blood.
So less carbon dioxide means our blood vessels get narrower.
Exactly. And when carbon dioxide levels drop, it triggers the body to constrict those blood vessels. Now, vasoconstriction isn't always a bad thing. Our bodies use it all the time to regulate blood flow.
Right.
But in certain situations, it can be a real problem, like during a heart attack.
So if someone's having a heart attack, the last thing we want to do is constrict their blood vessels.
Right, because we want to make sure that blood is flowing to the heart muscle.
But too much oxygen could actually make that worse.
It could. And to make matters worse, hyperoxia can also interfere with vasodilator medications.
Vasodilators, those are medications that help widen blood vessels, right?
Exactly. And high oxygen levels can make those medications less effective.
So it's like a triple whammy.
Yeah.
You've got air sacs collapsing, you've got free radicals causing damage, and you've got blood vessels constricting.
You got it. It's a lot to think about.
It is. It really makes you realize that oxygen therapy is not as simple as we might think.
It's definitely not a one-size-fits-all approach.
Okay, so we've talked about how too much oxygen can be a bad thing, but there are a lot of misconceptions out there about oxygen in general.
Oh, yeah, definitely.
Like people think that if you're short of breath, you must need oxygen.
Right, or that oxygen is always good for you.
Exactly. So let's spend a few minutes debunking some of these common myths about oxygen.
Sounds good. Let's clear the air.
All right, myth number 1, feeling breathless always means you're not getting enough oxygen.
That's a big one.
Right, like if you just finished a workout and you're huffing and puffing, You might think you need oxygen.
You might, but you might not.
So you could be gasping for air, but your oxygen levels could actually be totally fine.
Exactly. Breathlessness, or dyspnea, as it's called medically, can be caused by all sorts of things, not just low oxygen levels.
Like what?
Whoop. It could be anxiety.
Okay.
It could be a heart condition. It could be lung problems other than low oxygen.
So just because you're breathing hard doesn't automatically mean you need oxygen.
Right. And on the flip side, someone could have dangerously low oxygen saturation without even feeling short of breath.
Really?
Yeah, they might not even realize anything is wrong.
That's a little scary.
It is. That's why it's so important to actually measure oxygen saturation levels, especially in a medical setting.
Right. We can't just rely on how someone feels. We need to have that objective data.
Exactly. We need to know what's really going on.
Okay, so myth number 1, busted feeling breathless, doesn't always mean you need oxygen. What's another myth that we need to clear up?
Another big one is that oxygen is always helpful and always safe.
Right. I think a lot of people see oxygen as this like magical cure-all.
Yeah, like it's always going to make things better.
Oh, but as we've seen from all the research we've talked about, that's just not true.
It's not. Oxygen is a drug. Yeah, and just like any other drug, it has potential benefits and potential risks.
So we need to treat it with respect.
Exactly. We need to use it judiciously and appropriately.
And that brings us to another myth that more oxygen on your face means more oxygen is getting to your cells.
Right, like if we just crank up the oxygen, everything will be fine.
But as we discussed earlier, high concentrations of oxygen can actually make it harder for your lungs to absorb oxygen.
Exactly, because of that whole absorption atelectasis thing we talked about.
Right, so it's not just about delivering oxygen to the lungs, it's about making sure that oxygen actually gets into the bloodstream and reaches the cells that need it.
It's about the whole system working together.
Okay, so we've busted a few myths about oxygen. What's the bottom line here? What are the key takeaways for medical professionals and for everyday people who are just trying to stay healthy?
Well, the Thoracic Society of Australia and New Zealand has actually developed some really helpful recommendations that I think everyone should be aware of.
Okay, I'm all ears.
So for people with COPD,
COPD, that's chronic obstructive pulmonary disease, right?
that's right. It's a type of lung disease that makes it hard to breathe.
Okay.
So for people with COPD and a BMI over 40, the target oxygen saturation level is between 88 and 92%.
88 to 92%.
And they should only be given supplemental oxygen if their saturation drops below 88%.
So there's a specific range we're aiming for.
Exactly. It's not about getting it as high as possible.
Interesting. What about people who don't have COPD?
For everyone else, the target range is a little higher, between 92 and 96%.
Okay, 92 to 96.
And just like with COPD patients, we only want to give oxygen if the saturation falls below 92%.
I've got it.
And if it climbs above 96%, then we need to scale back the oxygen to bring it down.
So it's all about finding that sweet spot.
It is. Not too much, not too little, just...
Goldilocks and the 3 oxygen levels.
Exactly. We want to make sure we're giving the right amount of oxygen to support the body without causing any harm.
This has been a really fascinating deep dive. I have to admit, I've learned a lot about oxygen today.
Me too.
Things I never even considered before.
It's amazing how much complexity there is, even in something as basic as breathing.
Right. We just assume that we breathe in oxygen and everything's good.
But it turns out there's a lot more to it than that.
There is. And it makes you realize how interconnected everything is in the body. You know, how one thing can affect another.
Exactly. Our bodies are these amazing, complex systems, and we're still learning so much about how they work.
Absolutely. And I think that's one of the most exciting things about science. You know,
It is.
there's always more to discover.
Absolutely. And the more we learn, the better we can take care of ourselves and each other.
Well said.
You know what really strikes me about all of this is that even oxygen, something that's so essential for life, can have negative consequences when we have too much of it.
Right. It's all about balance.
It makes you wonder what other common assumptions about health and well-being might need to be re-examined.
That's a great question. What other truths are we taking for granted?
Exactly. And what other discoveries are out there waiting to be made?
I love that, this deep dive is a perfect example of how questioning the status quo and being open to new information can lead to better health outcomes for everyone.
Absolutely. We need to keep learning, keep questioning, and keep pushing the boundaries of what we know.
So to our listeners out there, we encourage you to dig into the source material we've provided, especially those Thoracic Society recommendations.
Yeah, those are a great place to start.
And never stop questioning, never stop learning.
That's the spirit. Knowledge is power, especially when it comes to your health.
Absolutely. Well, on that note, I think we've reached the end of our Oxygen Odyssey.
Oxygen Odyssey, I like that.
Until next time, stay curious and keep exploring.
See you on the next deep dive.
Bye, everyone.
Bye. It's incredible to think that something as basic as oxygen, something we literally can't live without, can have such a complex story.
It really highlights how there are so many nuances in healthcare. It's rarely a simple black and white issue.
For sure. We just can't assume that more of something good is automatically better.
It really is all about balance.
Yeah. It is. It's like that saying, the dose makes the poison.
Right.
Even water, which we absolutely need, can be harmful if we drink too much of it.
That's a great point. This whole deep dive has been a fantastic reminder that we need to be constantly questioning our assumptions, especially when it comes to our health.
Absolutely. And it also underscores how important research and evidence-based practices are in making sure we're taking care of ourselves and others in the best way possible.
So to our listener, if you're ever in a situation where you or a loved one are facing a medical decision involving oxygen therapy, don't be afraid to ask questions.
Absolutely. Advocate for yourself and your loved ones. Understand the risks and benefits and make sure the treatment plan is aligned with the most up-to-date scientific evidence.
We hope this deep dive has given you the knowledge and confidence to do just that. Remember, knowledge is power, and informed patients are much better equipped to navigate the often complicated world of healthcare.
So keep those brains buzzing, stay curious, and we'll catch you on our next deep dive adventure.
See you next time.
It really makes you think, if oxygen, something so essential for life, can be harmful in excess, what other common assumptions about health and well-being might need to be re-examined?
That's a really thought-provoking question. What other truths about our health might we be taking for granted?
It's a great point, and this deep dive is a perfect example of how ongoing research and critical thinking can really lead to better health outcomes.
So to our listeners, if something piqued your interest today, be sure to dive deeper into the source material, especially those Thoracic Society recommendations, and, never stop questioning, never stop learning.
That's the key. This deep dive has shown us how important it is to stay curious and to keep exploring new information.
Well, on that note, I think we've come to the end of our oxygen adventure. It's been quite a journey.
It has, and hopefully our listeners have a newfound appreciation for this amazing and sometimes perplexing molecule.
Until next time, stay curious and keep those brains buzzing.
We'll catch you on our next deep dive adventure.